Hello everyone, today we'll speak about systemic lupus erythematosus in children. So, SLE is a chronic multi-system autoimmune disease characterized by production of antibodies and immune complex deposition, leading to a widespread inflammation and tissue damage. So, for epidemiology, it's less common than adult SLE, and it's about 3 to 9 children per 100,000. It's more frequent in females more than male. It involves multiple organ systems damage like skin, joints, kidney, central nervous system, and hematologic system. Early diagnosis and good management are essential to prevent long-term damage. So for the pathogenesis, just let me get my laser. So, we will have a genetic predisposition for this one, familial clustering association with certain HLA types, like HLA DR2 or DR3, and environmental triggers like UV light exposure, infection like Epstein-Barr virus, and certain drugs can lead to it. Immune dysregulation, loss of tolerance to self-antigens lead to B and T cell activation and production of variety of antibodies like anti-nuclear antibody or anti-dsDNA or anti-Smith. Also, we will have immune complex deposition. Circulating immune complexes deposit in tissues like kidney, cause systemic SLE nephropathy, skin and joints, causing constant problem and inflammation in them. On cytokine environment, we'll have some cytokines released in the body that will lead to inflammation. Clinical features. So first of all, we'll have fatigue, fever, weight loss, and malaise. In the skin, we'll have a malar rash, which looks like a butterfly, photosensitivity, and discoid lesions. So this is the butterfly rash, malar, as we can see. This is another one. It looks like a butterfly. This is the the lesion, discoid lesion again. So these are the skin changes. Musculoskeletal, we'll have non-erosive arthritis, joint pain and swelling. We will have lupus nephritis, which is characterized by hematuria, proteinuria, hypertension, may progress to renal failure if untreated. Hematologic anemia, leukopenia, and thrombocytopenia. Neurological headaches, seizures, some dysfunctions in the cognitive dysfunction and mood disorders, cardiovascular, pericarditis, myocarditis, Lippmann-Sachs endocarditis, which can be seen in echo, and we will have pleuritis, peritonitis, and GIT problems. So we mentioned that these are the rashes and lesions that we'll see. For the diagnostic evaluation, you'll need some labs. NAA is high sensitivity, positive in nearly all cases. Anti-dsDNA and anti-Smith are highly specific for SLE. Low C3 and C4. And inflammatory markers, ESR and CRP will be high. In the urine analysis, if we detect hematuria, proteinuria, we will suspect lupus nephritis. And as we mentioned in CBC, we have cytopenia, low platelets, low leukocytes, and low RBCs. Yes, and for the diagnosis, we have some criteria like SLICC. We can follow it. This is the criteria. The SLICC classification. We have clinical criteria and immunological criteria. We need more than 4 criteria present, and we will confirm the diagnosis. For the chest X-ray, we will see it to reveal any pleural effusion or pericardial involvement, the echo to see the changes in the heart, a renal biopsy in cases of lupus nephritis to guide the treatment decision. So for the treatment, first of all, some principles. Early aggressive treatment is key to prevent irreversible organ damage, and multidisciplinary care is essential. Then to the pharmacologic management, antimalarial therapy like hydroxychloroquine, is good because it's control the skin and joint symptoms. Then we'll go corticosteroids because the disease is autoimmune, so we need to inhibit the immune system. Then immunosuppressive agents like methotrexate, which is demarked. Then we will go to biologic agents that will, which is called biologic demars, which will also inhibit some certain cells that are involved in the disease. Then we will do symptomatic treatment, NSAIDs for the joint pain, antihypertensive to manage the blood pressure if we have lupus nephritis, and we know that they have photosensitivity, so sun protection, and vaccinations. Just as a small recap to this one, we know that this disease is multi-systemic disease, so we need a multidisciplinary approach. We will take a guidance from multiple like specialists in different disciplines, so we can get the better prognosis. The complication, as we mentioned, lupus nephritis, cardiovascular complications, we already mentioned there, CNS problems, hematologic, we already spoke about them all. The prognosis, early diagnosis will promote the treatment and will make the organ involvement less, and we need to like long management of this disease. We already spoke about most of these points, so that's all actually. Thank you so much for watching. I hope you found this lecture useful. That's all. Thank you. Goodbye.